My name is Lucas Easter. I am a paediatric cardiologist. I work at the Royal Children's Hospital in Melbourne and work as a subspecialty area in paediatric cardiology called interventional cardiology. Congenital heart disease is a defect or disorder of the cardiac structure, function, or connections, or the major blood vessels that is present at birth. Those changes are very early onset in the pregnancy, well before some people even know that they're pregnant. There are a number of conditions that some patients may never be aware of. On the other end of the spectrum, we do see a number of cardiac conditions which we would consider critical cardiac or severe congenital cardiac conditions. When I think about congenital heart disease, I think about the abnormalities of the connections of the heart. I think about the abnormalities of the structure of the heart structure itself. Congenital heart disease is then also very commonly associated with extracardiac anomalies in around 10 to 15% of patients. The GI tract, the kidneys, neurological abnormalities as well. When you ask about the family history of congenital of heart conditions, we're talking about congenital heart conditions that other relatives are born with, as opposed to ischemic heart disease or acquired heart disease. Only 10 to 15% are linked to a known genetic cause. Informing families of what we know about the risks of recurrence of congenital heart disease is important to provide, but I think also trying to understand where the families are coming from and how that information, why they want that information and how it will help them is really important. And again, that's part of going on the journey with these families, is to kind of try and build a relationship and an understanding, and for them to build trust in you in terms of the diagnosis, in terms of the treatments, in terms of the ongoing management. Ensure that once you are their cardiologist, you stick with them for the entirety of their journey, if possible. In some circumstances, there may be an observational component and an ongoing monitoring management approach, where we see the patients very intermittently, ask them to monitor for certain symptoms or changes or signs, and then if they're worried or concerned, engage with their primary care physician like their GP, review their symptoms, and if there are any concerns, then obviously come and see a specialist. Some patients spend many, many months in the hospital, need multiple surgeries, and engage with a whole raft and range of subspecialty professionals. I think some of the many challenges that patients with congenital heart disease face require mental health input as support as well. It's really important to ensure that we're engaging and helping children and their families understand what these conditions mean. I always strongly encourage families to have a primary care physician or a general practitioner who they trust and who understands their child or family member's heart condition. I would certainly encourage particularly primary care physicians or other specialists involved in their care to use sources of information, I think, that are reputable and are well trusted. So certainly any of the hospital websites who are providing information will provide information for both patients, but also for healthcare professionals. Then, there's obviously broader bodies that are involved with patients with congenital heart disease. The Cardiac Society of Australia and New Zealand is a really important source of information. And then external bodies like the American Heart Association and the European bodies as well provide really helpful information.